Hey, it's Dr. Birchler from ChiroHealth Spine and Disc Center. I'm going to call this video why you should see a chiropractor first for spine and joint pain. And this intention of this video is not really to be critical or bashing of any other providers, but I have these conversations and scenarios that come up every day with patients, and people don't really see certain flaws in the system that are very, very apparent when you're aware of those flaws and are part of the solution to the flaws. But let me summarize this kind of quickly by saying many people, the first place they go when they have problems is their like family doctor, and so they may have back pain, they may have other things. A significant percentage of visits to family care doctors are for musculoskeletal stuff, back, neck, knees, hip, headaches, things like that. But the primary care doctor is not a specialist in spine. In fact, they have very little training, and as opposed to just saying that, I'm gonna read you a reference to some research that studied and surveyed this. This research study surveyed kind of the medical profession regarding their understanding or competency in physical medicine. Now, chiropractic is not physical therapy, but a lot of times these things that don't give prescriptions, where you're actually going to do something physically with the body, are just lumped into physical medicine. And this is saying 26% of fourth-year Harvard medical students, this is Harvard, it's not the community college, this is Harvard, fourth year, so they're about to finish their medical training at Harvard, and only 26% of them had any type of cognitive mastery of physical medicine. So they weren't able to take a test and understand physical medicine. And this is at the best university in the United States for medical school. Okay. Incoming interns at University of Pennsylvania, another Ivy League school, took an exam of musculoskeletal aptitude. 82% of the students failed to show basic competency. So only 18% of Ivy League medical school students had basic competency, not mastery. They weren't excellent, they weren't specialists. Only 18% even had basic competency at an Ivy League medical school, right? Perhaps the poor knowledge base resulted from inadequate and disproportionately kind of low numbers of hours of study in their curriculum. And of course, if you don't have training, you don't have study, you've not seen things, you don't understand it. Less than half of medical schools in the United States require any preclinical course in musculoskeletal medicine. So you can go through medical school and not have any required courses on stuff with the spine and the joints. You're not required to do that. Less than a quarter require a clinical course. Nearly one half have no required preclinical or clinical course. So about half of medical schools, you have no required training in musculoskeletal anything. It's all drugs, surgery, things like that. And surgery commonly, depending on the specialty, you are going to have that, orthopedics and things like that. But point of this is saying that you can go to the Ivy League best medical schools in the United States and have no required training, and the fact is, when you go to take a test or they test your competency, you don't know very much, because that's not what they do. Okay, so as opposed to going on and on about this, I want you to understand that the best place you can go for physical, my neck, my back, my knees, my hips, my things like that, is really chiropractic, because it is a specialist in the spine, in the body. And then, yes, sometimes people have arthritis. Maybe they need to go to an orthopedist, possibly need to go to a surgeon, possibly need to go to physical therapy, and the chiropractor can certainly direct or refer to those things. But it is very, very frustrating for patients, and I in particular Medicare patients, because of the failed, outdated system and not paying for services at chiropractors, which is a whole other issue, but is part of the problem in particular for Medicare, is that it's frustrating, because you go in, you're talking to somebody who's not an expert at things, and you get put into this wheel of stuff or given medication, and it's just a disaster. Frankly, it's inefficient, it's a lot of expense, poor results, put on medications with no solution to the actual problem. So those are some of the dynamics behind this, that the best place you can go when you're dealing with these kind of things is really a skilled chiropractor. because you can actually get a good evaluation, you can actually get physical help, and you can get directed to other people when those are needed, which in some cases they are. So hope this is helpful to somebody out there, and kind of keeps you out of the frustration and wheel of you entered into the system with the wrong person, and it turned into a lot of wasted time, wasted money, poor outcomes, high risk stuff that never should have happened, injections, surgeries, pills, addiction, all this kind of stuff, which the data shows all of those things happen when you enter that system, and there's a higher cost with less results. So from a kind of looking at this at scale, it's inefficient, it increases our cost, and that turns into you paying higher insurance premiums because it's just a broken way of looking at things. Okay, if you have anything affecting you with your your body, your physical body, your spine, your joints there, we would be happy to talk with you, try to assist you and direct you from there, so you don't have that experience.